This is Narayan. I'm one of the radiology residents. I'm going to be talking about intracranial space-occupying lesions. This is one of the 22 don't miss diagnoses for medical students. So just an overview of what I'm going to be talking about. The most important thing in classifying the intracranial space-occupying lesions is whether they're intraaxial or extraaxial, and we'll discuss this further in a little bit. Then we want to discuss whether the lesion is infratentorial, supratentorial, or whether it's intraventricular. Then once we describe the lesion, we can talk about the etiology of these intracranial space-occupying lesions, a neoplasm, whether it's a primary brain tumor or metastatic lesion, an infectious or inflammatory lesion, or a hematoma. Intracranial hemorrhage has already been discussed in a previous podcast. And then we will talk about complications from these intracranial lesions. One of the complications is mass effect and hemorrhage, and there has been a podcast on mass effect and on hemorrhage. So just as a review of CT findings, we see here that air is the darkest on CT. This is the frontal sinus, soft tissues. This is the bone, the very white density. Brain is intermediate gray. Edema we can see is a little dark. And CSF is darker than edema, but not as dark as air. This is just a CT review. So going over intra and extraaxial lesions, an extraaxial lesion is outside of the brain parenchyma. And as we can see in this example, there is this extraaxial lesion outside of the brain parenchyma that is pushing on the brain parenchyma from outside. And there's this mass effect on the brain parenchyma, but you can make out the gray-white distinction. On the other hand, this is an intraaxial lesion where a lesion is within the brain parenchyma and expanding from within the brain parenchyma. So just some examples of intra and extraaxial lesions. This is an extraaxial lesion, and that is within the skull but outside the brain parenchyma, as we discussed previously. And you can see this lesion here, which is outside the brain parenchyma, pushing from the outside. And this is a supratentorial lesion, that is, it is in above the tentorium, covering the cerebellum. So another example of an extraaxial mass. This mass is adjacent to the pons, and it's pushing on the pons. You can see that the pons is a little effaced with some mass effect. And this is a post-contrast study. We can tell because the vessels are bright on this MRI image, and the mass is avidly enhancing. But again, you can see this mass is outside of the brain parenchyma. Here we have an example of an infratentorial lesion, that is a lesion that's below the tentorium in the posterior fossa. And this is an extraaxial mass that is centered in the right cerebellopontine angle, and you can see it pushing on the brain parenchyma. And this is the fourth ventricle here, which has been markedly displaced to the left. One of the complications of these intracranial space-occupying lesions is hydrocephalus. Hydrocephalus means water on the brain, and that is when the normal flow of CSF is obstructed by one of these masses, the ventricles dilate and causes mass effect from within the brain. And this is one of the things to look for. You want to look for the dilated temporal sweeps of the lateral ventricles. That's a big sign of hydrocephalus. Here we have an extra-axial epidural abscess. So when you see a ring-enhancing lesion, the two big things you want to think about are either an abscess or a tumor of some sort. Those are the two big things to think about. And in this case, we have an epidural that is in the extra-axial epidural space ring-enhancing lesion, which is an abscess pushing from the outside on the brain parenchyma, and this edema right here is as a result of this infectious process. I just wanted to show an example of an intraventricular mass. Sometimes you can have masses that arise from within the ventricular system. This is a lesion that arises from the septum pellucidum within the lateral ventricles, and this was thought to be a central neurocytoma, which is one of the intraventricular masses. So now moving on to intraaxial lesions. Here we have a posterior fossa, that's an infratentorial intra-axial mass lesion that's arising from within the brain parenchyma. You can see this is from within the brain parenchyma, pushing the fourth ventricle here to the left. But you can see the difference in intraaxial mass is within the brain parenchyma, and the example I showed before was from outside the brain parenchyma, which is extraaxial. Here we have an example of a supratentorial, that's above the tentorium, intraaxial lesion right here that's causing a little bit of mass effect. It's pushing the midline a little bit to the left. This is an example of central nervous system lymphoma. You can see on this post-contrast MRI image, you can see these little foci of enhancement within the frontal and the parietal lobes on the left, and this is an example of an intraaxial lesion, and this was found to be central nervous system lymphoma. And here we have an example of a ring-enhancing lesion, which is intraaxial. You can see right here it's within the brain parenchyma, and there's a ring of enhancement on this MRI image. And just a couple of final points. One of the things to think about if you see multiple lesions, so you're looking at a brain MRI and you see a lot of these ring-enhancing lesions. In this case, there are at least three. There's one here, and one here. The things you want to think about first are Mets, that you have a primary tumor from elsewhere in the body that is metastasized to the brain, or you want to think of an infectious lesion such as an abscess or toxoplasmosis or other infectious etiologies. And just a final point on the role of diffusion. Frequently these intracranial lesions patients will get MRIs, and a lot of the times you want to look at the diffusion weighted images. So let's say you see multiple ring enhancing lesions like we did on the slide before, and in this case you see that there's no restriction of diffusion. That is, these lesions are dark on the diffusion weighted sequences. That makes us think that these are more metastatic lesions, that they're malignancy rather than infectious lesions. Usually infectious lesions restrict diffusion, whereas neoplasms do not, and that's one important thing to keep in mind. And this is the end of our podcast on the intracranial space occupying lesions.